So welcome everyone to our webinar today, or our important special event that we're hosting today on Ageism Awareness Day, Rebelling Against Ageism. So I'm so pleased today to be collaborating with our partners with the Canadian Network for the Prevention of Elder Abuse, as well as the Canadian Coalition Against Ageism to host this event today. I'm going to turn over our emceeing a little bit to my partner with Benedict Schefflin, who will give our land acknowledgement and other opening remarks.
Good morning, good afternoon, everybody, and thank you for joining us today. As Rayan mentioned, I'm Benedict Schefflin. I am the Executive Director of the Canadian Network for the Prevention of Elder Abuse, and it's my great pleasure to welcome you all today. Before we go any further, I would like to acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We are seeking a new relationship with the original peoples of this land, one that is based in honor and deep respect. And that's throughout our work at EAPO, CNPA, as well as the organizations represented today. Now, we're going to take you through a couple of text slides and reminders before we go any further. So I want to reassure everyone, you are automatically muted during the webinar in order to preserve the quality of the sound. As you can see, we have quite a few people present today, and we are recording this session. So please feel free to make some noise if you want on your end. We will not be hearing you. You have options in terms of seeing the speakers on your screen. You can choose to see one speaker or all of them, and you can rearrange that by using the little button at the top of your screen that says View. And the speakers will be presenting and will be visible while they present, as well as during the Q&A at the end. And if you want to make the image slightly bigger or smaller, there is a sort of vertical line on your screen that you can slide to the left or to the right to make the image bigger or smaller. There is two options for you to, or are two options for you to communicate today. There is a chat box that you can use to post comments during the session. You can interact with each other. You can share links that are relevant to the conversation. And then at the bottom of your screen, there is a Q&A logo and the two little speech bubbles. So if you click on the Q&A box, you can enter your question, type it out, and we will read it out at the end to our speakers. So they will not be answered during the session. They will be answered at the end during the Q&A. I see there's a raised hand. I'm afraid I cannot take your question right now, but do please type it into the chat box, sorry. Q&A box is what I meant. In terms of evaluation, we always welcome feedback. It helps us kind of improve our sessions from one time to the next. So you will have a pop-up notice at the end of the session with a link to a survey to let us know how we did, and you will also receive a follow-up email with a survey link. Please, if you have a minute, do fill out the survey. That does help us out a lot, and you can also suggest future ideas for the webinars in the future. And again, the webinar is recorded, so if you cannot, for some reason, stay until the end, you will be able to watch the recording on both the website of EAPO and CNPA by the end of the week or after Thanksgiving if you're busy. And one final reminder, the chat box is a very welcoming and safe space. Nonetheless, it is also public. So we ask you not to share any private detail about any situation you may have that you want to, if you want to discuss any situation of potential abuse, any private personal concern, do get in touch with Rayan or myself directly, but do not share those details in the chat box or in the Q&A box. Thank you very much. Okay, and then for those of you who don't know CNPA, we are the Canadian Network for the Prevention of Elder Abuse, and our mission is threefold. It is to connect people and organizations to foster the exchange of reliable information about elder abuse and neglect and ageism, and to work on practice and policy development on those issues. So we do this work at the national level, but also collaborate with local, regional, provincial, territorial partners all the time. And our goal is a society where older adults are valued and respected and live free from abuse and can thrive with the right supports. And then I think, Ryan, if you want to say a few words about EAPO.
Thanks, Benedict. So for those who are also joining us who aren't familiar with Elder Abuse Prevention Ontario, our mission is similar to EA or CNPA, but we really want seniors to be free from abuse, have a strong voice, and feel safe and respected in their communities, no matter where they reside. In 2003, our organization has the opportunity and the mandate to implement Ontario's strategy to combat elder abuse and has been doing so since then. And that is funded through the Ministry for Seniors and Accessibility. And with that strategy, there are three main pillars that we work under and deliver education and awareness. We do a lot of educational campaigns, promote education to seniors around prevention. We provide training to frontline staff in all sectors. And we work most importantly with our community partners to strengthen the response and intervention to support those who may be victimized by abuse in their communities. I do want us to maybe just start the conversation with a video that we produced just recently in collaboration with CNPA, as well as the Center for Violence Against Women and Children from Western University on ageism. And we know that ageism crosses all ages. And what we wanted to do is provide this as an educational tool. You can find this on our website as well. But just sort of maybe just to start the discussion, to get people thinking about ageism if you haven't been aware of it in the past. So I'm hoping this will work, and we will start it.
Being treated unfairly because of your age is called ageism. It is the most tolerated form of discrimination. Too old, too young, act your age. These are things we hear our whole lives. Ageism impacts everyone, especially as we get older, and it is everywhere. Being ignored, talked down to like a child, or treated as a burden, it all adds up. The negative messages are clear. The more you age, the less you matter. Advertisers spend and make billions to sell us anti-aging solutions. We learn to fear wrinkles and gray hair rather than embrace the process of aging. The media describes older people as frail and failing, or as rich and selfish. These are hurtful stereotypes. In the workplace, older workers are lumped together as slow and inflexible. They are passed over, held back, and even forced out. Too often, older people are not consulted about their healthcare decisions. Their concerns are dismissed as normal signs of aging and treated like an inconvenience. When others see you as less worthy because of who you are and how old you are, your risk for mistreatment increases. There is a strong link between ageism and abuse of older people. Age discrimination isn't just unfair, it is a violation of your human rights. It doesn't have to be this way. Nearly 1 in 5 Canadians is over the age of 65. Older people are mentors, entrepreneurs, volunteers, teachers, artists, friends, and family members. We have so much to learn from each other and to share as we age. You can change how you think, feel, and act about getting older and about older people. Start right now. Join us. Aging is not the problem, ageism is.
So hopefully that sort of just maybe sets the stage for us to think about our own perceptions about aging and intergenerational connections and having those conversations for just thinking about how we perceive older adults in our lives, whether we're at work, working with clients, or our own family members. So it gives me great pleasure to introduce our panel today, who have expertise in some of those areas that were addressed in the video. In terms of our healthcare specialist, we have Dr. Kiran Rabheru, sorry, Karen, who is the chair of the International Longevity Center, a professor of psychiatry at the University of Ottawa, and geriatric psychiatry as well. And we also join, and Dr. Kiran has been a long time involvement in the area of ageism, a great advocate for seniors, has done lots of public education and awareness on these important issues. And Dr. Claudia Mahler is an independent expert on the enjoyment of all human rights by older persons. And she will talk about her recent report that she has just recently written. I think people may have seen it on, and she will speak on the violence around elder abuse, and the intersection around ageism is included within that report as well. And she'll give us more details on that. And then lastly, we're joined by Margaret Gillis, not lastly, but also on the panel. She's also the founder of the president of the International Longevity Center, along with Kiran, that they work together within that organization. So thank you all for joining us today and for sharing your time to contribute to this panel discussion today. So before we get moving forward, I did want to just sort of set some of the stage, but sort of why we're having this conversation. So the Canadian Network for the Prevention of Elder Abuse and Elder Abuse Prevention Ontario, we really are pleased to have the opportunity to work with the Canadian Coalition Against Ageism. This webinar is not only being hosted to inform you about the actions that are being taken to rebel against ageism, that address age discrimination and prevent abuse, but it's also about our collective partners who are joining us today, as I just introduced, who are also here to officially launch the Canadian Coalition Against Ageism. This is the first of its kind in Canada, so it's extremely important organization that everyone needs to be aware of, and how we can all get engaged and taking action to support this work that they're doing. But this event is also an inauguration of Ageism Awareness Day in Canada, which is held actually this coming Saturday on October 7th, but we're hosting this event ahead of time to bring to light this important issue, to give individuals the opportunity to partake in individuals to engage in some of these activities and social media campaigns that they will be talking about today. And our aim is to have this important day of awareness day in Canada to turn into a global awareness day. So it takes all of us to work together to meet that goal. And hopefully this is the starting point of pushing that agenda forward. So ageism is how we think, feel, and act towards others and ourselves based on age. Ageism affects all of us at all ages and stages in life, whether we're youth, in our teens and middle ages, or in retirement years. We hear ageist remarks exchanged between all ages and stages, judging based on people's looks, how they dress, how we speak. And we even do it to ourselves. We make ageist comments. No matter what age, it happens to all of us. But one fact that we do know is that based on research, and most importantly, our individual experiences, that age discrimination prominently affects older adults. We have known this for a very, very long time, but unfortunately, it was COVID that really brought the pandemic ignited the discussion around ageism and the way that people were being cared for in healthcare and in long-term care settings. The stereotyping and treatment of seniors during the COVID pandemic sparked that wake-up call for everyone to think about what are we doing and how are we treating our older adults in our society, to reevaluate our behaviors and our actions, ethically, morally, and also legally, to explore the different ways that we can address this issue and protect individuals. But not only with that, in conjunction with ageism during the pandemic that was ignited, also elder abuse hit the headlines. It was often not talked about as we are in the limelight now. It was most often ageism and abuse for seniors is harmful and sometimes violent, actions. Those are the issues that were meeting the headlines and newspapers and TV reporting, and talked daily amongst friends, family members, and communities across the world. So my question is, why does it take a crisis to start the conversation, to pay attention to the behaviors that violate the human rights of older persons? Today, we bring to light these issues that we can carry on these conversations, that they don't just stop, that even though sometimes the pandemic, even though it's still here, that while we need to carry on these conversations. So today we're hoping that we can carry on that, learn from what we have experienced, unfortunately, through that pandemic, learn about the actions that we can take and what are being taken to create a more inclusive society for all of us to live together. So today you may hear some similar themes, ideas, or recommendations from our speakers, but that's just telling us that we do align or have a strong agreement among our agencies, organizations, and individuals that change is needed. So we can all take action and build on this global movement for change to make sure that seniors are treated with respect and dignity in our societies. So we are going to, the format that we're taking for this discussion today is that we will first initially have Kiran talking about the Canadian Coalition and the work that they're doing around ageism. We'll talk around the Convention for the rights, on the rights of older people that could counter age discrimination and prevent elder abuse. And then we're going to highlight the work that is being done at the international level and that Claudia has done in terms of her report to also bridge that issue around ageism and violence and the work that she's been doing at the UN level as well. So I want to start with Kiran, who is just asking just a little bit around the conversation about ageism. We've kind of, some people may know a little bit about ageism, but it's becoming, the conversation is becoming a little bit louder in Canada and around the world. So can you briefly explain a little bit more in detail for everyone today? What is ageism and how do we define it? And how does it impact individuals for their quality of life?
Well, thank you very much. So thanks, Rayanne, Benedict. And I would really like to say that it's such a privilege and an honor to be here with you all today, especially joining Claudia Mahler, who is an international expert, and you'll hear from her in a few minutes. Claudia, thank you for joining us, and Margie as well, Margaret Gillis. Can you just go back to the previous slide just for a second, if you don't mind? Perfect. I just wanted to tell you a couple of quick things. So I'm going to talk to you in 3 different segments. What is it that we're talking about? Why are we talking about it? Then the second point is, so what? What is the impact of all this? And then third, now what? What are we going to do moving forward? And this is a really special day because after today, I'm hoping that every Canadian who has listened to this or will be affected by each one of you will change the nature of ageism in Canada over the next few days, weeks, months, and years to come. And you can do this. This is, ageism is the only ism that will affect every single human being, regardless of their age, sex, race, color, gender, what have you. That's why we need all hands on deck. We need every single one of you to act and act now to make life better for people. Now, next slide, please. So let me tell you that never before in the history of older people's human rights, never have they been violated as we have witnessed recently around the world. Older people have been left behind, voiceless, invisible, and expendable. Their basic needs have been ignored, neglected, or dismissed. If you look at this slide, it explains a little bit of why this has happened. If in the 1800s, people didn't live past the age of 30. Okay, that this is the life expectancy at birth. If you go 100 years later, and most people didn't live past the age of 50. But look at what's happened since then. Most people today, even if you're in the poorest part of the world, can live to 70, And if you look at the more developed countries, most of us live to 80 and 85 years of age. So what's happened is that people have not been able to plan in a proper way as to how we're going to manage this cohort of people. Next slide, please. So what is happening to our perceptions of aging? This is a little painting called 3 Ages of Women and Death. There's a baby at the bottom of the slide. And this painting is by Hans Baldung, painted in 1500s. And it's you can see it at the Prado Museum in Madrid. And what it shows are the stages of men from young adulthood to middle age to old age and then to death. As I said, this was 30 years of gap between birth to death. And today we have many more decades to expand this. As a physician, I can tell you that care and the culture of care is what we need to address, not just in healthcare, but in every sector. And what does the word care mean? Care, it means kindness, compassion, and humane attention to other beings. And these are critical attributes to have in us when we treat other people. And failure to do so constitutes carelessness or negligence when the standard of care is not met. And one other thing I want to add is the culture of care. And what I mean by a culture of care is going beyond what is expected by law to ensure that compassion and respect are given to the person and to the care providers around them. Next, please. So what has been going on here? This also happens to be the United Nations 75th anniversary since the Universal Declaration of Human Rights was created in 1938. We have not seen anything that has positively affected older people. In fact, all we've seen is the violations have gotten worse and worse and worse over the decades. And during the pandemic, we all saw the worst atrocities of violations. The second thing I want to highlight, and Margaret and Claudia will talk about this in a few minutes, is the open-ended working group, which is a group created to address this at the United Nations. We have been meeting for 13 years to address this, and yet nothing has changed and nothing has happened. So this is what led me to think we need to do something differently, because the definition of insanity is to keep doing the same thing over and over again and expecting things to work out better. Next, please. So let me talk briefly about the whole concept of what we can control. This is a little crystal ball, and all that it's meant to reflect is the way you think, the way you feel, and the way you behave. Every single person has control over those 3 things. And according to the World Health Organization, people who think, feel, and act in a prejudicial way towards other people because of their age are called ageist. At least 1 in 2 persons around the world are known to be ageist towards older people. And this is, if you haven't seen the report, I would strongly urge you to Google it and download it and have a look at it. It's called the Global Report on Ageism, published in March of 2021 by the World Health Organization. Ageism is widespread in all areas, including healthcare. It is toxic, it is very costly, and it results in autonomy, loss of independence, poor quality of life, and it harms the economy, creating inequity, injustice, indignity, and serious intergenerational conflict. Ageism also intersects with a lot of other isms, including mentalism, ableism, sexism, racism, and other isms that you can think of. And it affects people over their entire life course, fueled by huge gaps in global policy and laws. And it also impedes the promotion of healthy aging. What we permit, we promote. Let us not permit this to happen. Next, please. So in order to address this, when this report came out, the Global Report on Ageism, Margaret and I put together a little concept note, which I'm happy to share with you. By the way, if anybody wishes to have any information from us, including the materials we're talking about, please write to us and we'll make sure that you get it. I'll give you our email addresses at the end. So back in the fall of 2021, we put together an idea that we should get the persons who are working with older people in Canada together and create a coalition against ageism. And this is what I'm here to talk to you about briefly today. Next, please. So the Canadian Coalition Against Ageism is a nationwide social change movement to combat ageism against older people while protecting and strengthening their human rights. Next, please. Let's play the video now, if that's okay. This will explain a little bit more of what CCAA is about, and then we'll talk a bit more about it. If you click on the video and thank you very much. So I'm very, very excited today to tell you that International Longevity Centre of Canada, along with its partners, have launched a national campaign called CCAA, or Canadian Coalition Against Ageism. The soft launch was last July when Dr. Mahler, Claudia, thank you, came to Canada, and we actually had a soft launch at Margaret Gillis's home. In November last year, we actually got all of our coalition members together in Ottawa, and later in Toronto, in November. And we launched this, and today is our formal public-facing launch of the coalition. So I'm very, very excited about this, to get Margaret and Claudia on this call as well. So thank you for that. Let me explain the thinking behind this coalition. So I like to draw pictures and think about how we can make things easier to understand. So the base of the pyramid are where you and I live, civil society and older people, and I count myself in. We've talked a little bit about older people being disconnected, invisible, and voiceless for decades, and especially during the pandemic. If you go to the tip of the pyramid, we already talked a little bit about the work that's been done at the United Nations, the World Health Organization, the Human Rights Council, and I put member states in there, which are all the governments around the world. They should be doing something more about it, but they haven't been. And today it's our job to hold their feet to the fire and make them do their job better. But the problem is that the civil society and older people they're not connected to what's going on at the UN, the WHO, And traditional and non-traditional partners that are in the middle part of this pyramid need to do this connecting, which is what the coalition is. That's why we formed this coalition of partners and disciplines who actually have a huge sphere of influence, large networks and connections, and certainly more resources than older people who live on their own, who are disconnected and invisible. And we want to make sure that older people's voices are heard at the government level in their own country, but also at the United Nations and Human Rights Council. I hope that this has been a helpful picture. Next, please. So these are our founding partners. We have a steering committee of partners who represent all of these, including both EAPO and CNPA are very much involved in our work. Next, please. And today, I'm also very excited to tell you that we are launching Ageism Awareness Day as a national day in Canada, which is technically on Saturday. I think Benedict or Rianne did mention it. Even though we're hosting the talk today because of being on a weekend, it's harder to do it. But please amplify these messages. We have a whole toolkit that is available to people, although we haven't actually launched it out to the public yet. If you're interested in knowing more about it, please write to me. My email address is kiran.rabheru@ilccanada.ca. If you can look at my spelling and so on, it's kiran.rabheru@ilccanada.ca, or you can follow #CCAA Ageism. Next, please. So our goals today are to publicly launch the CCAA. I told you about that, to raise awareness of ageism, and to invite people to join CCAA. And you can join by just simply typing in bit.ly/CCAA Ageism. And we need all hands on deck to make this work more effective and efficient so that we can achieve our goal of eliminating ageism in Canada. I believe this is my last slide, Rianne.
Great. Thank you so much, Kiran, for that great overview around just defining what ageism is and how many people are actually affected. I think sometimes we don't think of the extent of older adults that are experiencing these, harmful behaviors and comments from individuals and the violation of their human rights. And just to put it in that perspective, 1 in 2 individuals and the impact it has on their health and well-being, whether that's their, physical or emotional health, and that can have long-term impacts on it. So you did mention also the work that's being done at the open-ended working group on aging, both with the involvement of Claudia as well as Margaret. Margaret, I just wondered if you could maybe just tell us a little bit about what you're about that open-ended working group and your role at the International Longevity Centre in Canada, and what that has meant to your work at that international level. And maybe you could just give us a little bit of an overview of the work that overview of the work that Canada has done over the recent years at an international level to give us that, put ourselves as a nation at that table.
Great, thank you. I'm very happy to do that. So the International Longevity Centre of Canada has been working consistently since its inception in 2014 to get the Canadian government to support a United Nations Convention on the Rights of Older Persons. We've been very active at the United Nations Open-Ended Working Group on Aging, which you'll recall Kiran spoke about. It's the meeting each year on older persons' rights at the United Nations, and it takes place in New York. Now, I have to tell you, it behooves me to understand why our government is not supporting the Convention on the Rights of Older Persons. Indeed, they should be leading the way, as they have done so many times in the past. And in fact, Canada led the work to get the Convention on the Rights of the Child. They were huge players in the Convention on the Rights of Persons with Disabilities. Canadian wrote the initial document that the UN called the Universal Declaration of Human Rights. And yet we are absent, well, not absent, but we have not yet supported a convention. In any case, it's really hard to think when you look at the Canadian government and the reaction to it that there isn't a little bit of ageism being played in that role. Now, that said, there has been some movement on working to get a convention. Last April at the United Nations Open-Ended Working Group on Aging, the new NGOs that had joined that year, 1/3 of them were from Canadian NGOs. And that was really a push that we started through the beginning work at the CCAA and earlier meetings that we had with large groups in Canada. We want to see more Canadian civil societies come to the UN. The Canadian government needs to see you there. So I just want to make that plea to come. It will be in March 2024, and usually around January, you can start to register. Now, last year was also the first time we had a Canadian minister attend the United Nations meeting on aging, with then Seniors Minister Kamel Kara coming to the meeting. It was also the first time that the Canadian Mission had hosted an event for member states at the meeting, something it does at almost every other UN meeting. Indeed, Canada's United Nations Ambassador brough hosted the event, and he actually noted there that there was a huge increase in the number of Canadian participants. And then he commented that this is how you get social change. He's been a pretty good supporter, by the way. And also at last April's meeting was the very first time substantive resolution, meaning a declaration that was agreed to by member states, was adopted by the Open-Ended Working Group on Aging, calling for co-facilitators from 2 member states to look at the need for more robust action on the human rights of older persons. Now, there's a call out right now for civil society and member states to support the work of those co-facilitators by filling out a questionnaire, which allows us to call for a convention. So I hope you, those of you who are members of organizations, will respond to that. I want to tell you that you can check out the website of the Global Alliance on the Rights of Older Persons, and we have Margaret Young on the line here today. Margaret is the head of the Global Alliance on the Rights of Older Persons from BC. And there's lots of information there on how to fill out the form, and it'll connect you to the form. What the form does is it basically calls for examples of human rights abuses of older persons. And as we discussed, there are many illustrations from the pandemic. What we want you to do is respond. It asks you what were the human rights violations and how to respond. And we're asking you to respond, we need a convention on the rights of older persons. So let's continue to work together to ensure our country considers the rights of its older persons. In regard to the Convention on the Rights of Older Persons, it would be great to get more Canadian organizations also to call on the government in Canada to start changing their view, their stated view on the convention. They can do that with working through the Canadian Coalition Against Ageism. It would be great to have a groundswell of Canadian organizations join us at the Open-Ended Working Group in 2024. The government of Canada needs to see us, and they need to see our strength and our numbers. Let's think of the majesty of this moment, of Canadians coming together to address ageism with a yearly event. Let's name ageism, call it out, and defeat it. So thank you.
Thank you, Margaret. That's, I think that call to action that we can, and sometimes people feel that they may not be able to contribute to have a voice at the table for some of these events that do happen at the UN. I think when we think about UN or World Health Organization, it's, it's way out there and I don't have a voice, but this is really providing people this questionnaire, an opportunity to really share their experiences and have a voice at that table. And that when people do share their experiences, that is all taken into consideration, put down into big themes that people are having. How can we develop new recommendations to address these issues? Because what we're hearing in Canada may be the same in other countries. So I know that I think Benedict has put in the links for this questionnaire, and we'll post that after also on our websites for people to access that. So it's not just for organizations, but it's for everyone to have that voice. So thank you for informing us about that information. So Margaret, I just wondered if you could give us a little bit more information around the convention itself. you've discussed the open group, as you just mentioned, and the need for the Convention on the Rights. Has there been any has there been work on aging issues at other UN meetings, or and if so, is the Canadian government at those tables, or is it just the
Sure.
human rights of older persons that we're talking
Yeah,
about?
I can tell you a little bit about some of the other work that's going on. So, basically name a human rights issue and you'll generally find out that older people are falling short. And there are also a number of shortcomings in the recognition of older persons at a number of UN meetings. So I want to share a little bit of that with you, and also acknowledge that it's getting better. And I really want to call out a thank you to Claudia, Mahler, our UN independent expert, who has been leading the charge on a lot of these changes at different UN meetings. So just a little background. In 2019, I happened I attended the UN's Commission on the Status of Women, the annual meeting on women's rights. And I have to say, there was an appalling absence of any discussion on older women. It almost seemed like older women after 49 didn't exist. And I learned from other NGOs on aging who had been attending that they had been waging a battle to change that, and they had felt quite invisible. I also noticed, however, that there was a number of Canadian ministers attending the Commission on the Status of Women, and the Canadian mission had this big event for the NGOs and the member states. And moreover, there was an actual minister's delegation of NGOs attending with the minister at the Commission on Status of Women. And by the way, none of these things happened at the UN's meeting on aging. No ministers had attended, no mission events, and no ministerial delegations. Sound ageist to you? I asked the Minister for Women why that was so, and the next year I ended up getting invited to attend as part of the minister's delegation, so you get what you ask for, right? But it turned out to be a great experience, and it allowed me to access Canadian diplomats who were working on all the drafts resolutions that were coming out of that meeting at the Commission for Status of Women. And we were able to get references to older women in those resolutions from the Canadian government and to continue to work on them in the future. But we need more Canadian NGOs to attend and push for the rights of older women. So it's another way in which you can engage and work for human rights. We also, as I mentioned, Claudia's work, generally, she has been a huge advocate for us at the UN Human Rights Council in Geneva, where her office is situated. Again, she is here with us today, and she's been nothing short of fabulous, and you're going to hear all about what she's been doing in a moment. I want to mention, though, last summer, there was a really important meeting at the Human Rights Council. It was called the Multi-Stakeholder Meeting on Aging. And human rights-based member states and the NGOs were very clear at that meeting that we needed a convention. The resulting report from the Human Rights Council unequivocally called for a UN Convention on the Rights of Older Persons. So as mentioned, we need to work to get the Canadian government to support the UN Convention on the Rights of Older Persons. Back in 2018, we did a petition, which we brought to the UN, asking for Canada to lead the petition. They told us the door was open, but ever since they have not bothered to step through. So we really need to push them on that. I want to mention, though, that the Canadian Embassy in Geneva, led by Ambassador Leslie Norton, has been extremely supportive of our efforts to include older persons on human rights work. We actually met with her last week to discuss our work, and we're going to continue to work with them. The one little interesting piece, each year the Canadian government at the Human Rights Council does a special session on violence against women. So we asked them if they would do a session on violence against older women at the Human Rights Council in 2025. And we'll need to continue to lobby for this event, but we hope we can get them on side. And another little quirky occurrence that I want to tell you about happened last week at the UN Human Rights Council in an informal meeting. The Russian members brazenly noted, the Russian government's members as a member state, noted that older people are not able to fully do not have the full right to participation because there's no convention on the rights of older persons. And this is really rich because the Russians and its supporters have worked hard to deny human rights of older persons, including working against a convention on the rights of older persons. So they're kind of talking out of both sides of their mouth. I guess that's not a huge surprise. But we need countries like ours to stand up to human rights deniers like Russia and its supporters. And we need a UN Convention on the Rights of Older Persons that protects us from human rights deniers and from human rights violations at home and internationally. So thanks.
Thanks, Margaret. And you made some really good points there, especially, when we think about violence of older women. We talk about gender-based violence, and so often we don't think of older women in that cohort. We think about sort of middle-aged or younger women, and it's often, going back to what Kiran had mentioned about that invincibility, right? Like not seen or not thought of in that context. And yet we know from data and statistics and people coming forward that older women are experiencing violence and going to shelters that has increased and leaving their homes at an older age of 70 plus. So you can imagine the dynamics that do go around that. So I commend you for all the work that you've been doing, as well as all three of you and Claudia at the UN to push this agenda forward. So just Margaret, just one last question around the convention, and
Sure.
We recognize that that's so important. So how will the convention, for those who are here, how will that curb ageism? Like, what is that connection for people to sort of understand that piece?
Sure. Can I just take you down a quick little trip down memory lane, like of horrific human rights violations that we saw of older persons in Canada during the pandemic? And I'll do it quite quickly, but I want to connect that to what a convention could do. So think about it. Older people were denied the right to life and long-term care, denied the right to health by being barred from hospitals, and denied access to life-saving equipment, denied the right to be free from abuse and neglect as elder abuse skyrocketed without any interventions, and on and on. Now, it requires a quick backdrop on the human rights law to understand how older people have been left behind. To begin with, the grounding document for all human rights legislation is the Universal Declaration of Human Rights. And this is a seminal document, with the beautiful words, all human beings are born free and equal in dignity and rights. But it's a product of its time. It was written in 1948, right after the genocide of World War II. Now, notably, it was drafted when the average life expectancy in the world was 64. Remember Kiran's chart a little earlier. And of course, it's much higher now. And while the Universal Declaration of Human Rights lists a number of groups that face exponential prejudice, it doesn't include age. As a result, there is no clear articulation in any of the United Nations human rights treaties of the nature and significance of aging and ageism, its social construction, and the phenomena of ageism. And without such a coherent conceptual framework, the international human rights system will continue to fall short in delivering on promises to all people, including older people, who need to enjoy full human rights. And that's why we're working to get a convention on the rights of older persons. Now, I want to tell you, my interest in this is almost personal. I worked in the government of Canada, and I was responsible for responding to the United Nations, organizing all the information for government on the Convention on the Rights of the Child. I saw what conventions can do, and I'm convinced that we need one for older persons now. We know a number of other groups have the protection of the UN conventions, such as women, children, and persons with disabilities, but we don't have one for older persons. And for those of you new to this issue, I just want to tell you a quick moment how a convention will support the rights of older persons. In general, it's a method of achieving positive change by combating ageism and by providing a universal framework with a moral, ethical, and legal lens. It would guide policy making by creating a structure for policies and providing a way to allocate funding more fairly. And one of the great things about the convention is it improves accountability. Governments would have to appear before the Human Rights Council every 5 years to report on progress, and civil society can be there to report on what's really happening on the ground and hold government's feet to the fire in terms of changes and responding to necessary human rights violations. Finally, a convention can educate and empower, and it would see older persons as rights holders with binding protections under international law. The bottom line is governments has a role to play in joining the campaign to end ageism and support the human rights of older persons, and all governments who love human rights should be supporting a convention. So thank you.
Thanks, Margaret, for that, just that clarification, because I think sometimes we don't see that connection, and just for people to sort of understand the dynamics that go behind that, and that we do have conventions for other sectors and issues. And so why are older adults, why has it been taking so long to get this going and to get the adoption of that by our government? You know, we've talked, you know, I think, you know, Kiran, you were talking about, you know, sort of those ages and the priorities. It's like, you know, it just makes sense. This is like the 13th year and we're still talking about making that progress. So, you know, as I was saying in my introduction, like, what does it take? Like, well, we've had this COVID pandemic crisis that really brought this to the forefront. And we've been talking about this for years. You know, I've worked in the field for many years and it's like, oh, this is happening. Like we all know what's happening, but what we all can take action. And now's, you know, if now is not the time, when are we actually going to do something about it? So this actually leads really well into Claudia, the work that you've been doing.
Rianne, may I?
Yep,
Rianne,
sure.
may I just make one quick comment just to bridge this gap?
Yes.
You know, one thing that the governments understand is votes. And through CCAA, we can reach 10 million plus older Canadians. That is why we need all hands on deck so that we can get to the Canadian government with votes to help us fight ageism and get a UN convention. Thank you. I'll pass it back to you.
Thank you. Because, you know, strength in numbers and the voices that are heard make change, right? And it's not just one organization, it's a collaboration across Canada, not just, you know, one province or territory. So, so thank you for that, Kiran. So Claudia, you know, Margaret was just talking about, you know, that the intersection between ageism and, you know, the human rights issues. And we talked about ageism and the abuse of older persons. And now you just recently wrote that report on violence, abuse, and neglect of older persons and presented it at the Human Rights Council. You spoke to governments and stakeholders and welcomed direct submissions for that and contributed. And I know our organization was part of that. And can you tell us a little bit more about what you found out when it comes to ageism and the convention and the connection between violence and older people? Because we do talk about it, and even in that little video that we showed initially, it does show that connection, but sometimes you know, people may understand it. We know research is that ageism is a root cause, but maybe you can just unwrap that a little bit more for people.
And I hope you also allow me to introduce the mandate, because there might be many people here in the room, in the Zoom room, which have never heard about the UN Independent Expert on the Enjoyment of All Human Rights by Older Persons, which is a title which is very long. But I think the emphasis should be on the enjoyment of all human rights by older persons, which also shows us already that we are missing something. Margaret already elaborated that the convention would be a wonderful tool to give us guidance how to better implement the human rights. And she also pointed out, and you as well, that there are other conventions already in place, which have a treaty body, which gives guidance, which gives us awareness, and which also, you know, bring governments to introduce new laws and change their policies. So even this might not be too good for everybody to hear, but I'm the only mandate in the whole UN with a specific focus on the human rights of older persons. There is no other treaty body, there are no other special rapporteurs, there is no special envoy, and there's nobody else. And to be honest, this is not sufficient. This is not good enough for older persons. And one might question if this is also ageist in regard of the UN system. So is there a structural ageism in the system? Having said that, I first would love to thank you all for including me in this wonderful event. And I think it's really good to raise once again awareness to ageism. And as I said before, I'm the only mandate, and the mandate was introduced in 2013. I'm the second mandate holder, so it's a very young mandate. My predecessor, Rosa Confeld-Matte, from Chile, laid the basis for my work today. And I would also like to say once again that we heard from the Secretary General to the International Day of Older Persons on the 1st of October that he also once again reiterates that studies show that the numbers of people aged 65 years or older worldwide is projected to be more than doubling in the next years. So rising from 761 million in 2021 to 1.6 billion in 2050. So also the numbers of people aging about 80 years old grow much faster than other age groups. And I think this also once again shows quite clearly that one person with a very small office is not sufficient. But the scope of the mandate is quite interesting, and I have a couple of tasks to fulfill. One are the thematic reports, which you mentioned. I just released the thematic report on violence. So I'm dedicated to have 2 thematic reports and 2 country-specific reports each year. The thematic reports give me the opportunity to go into more detail on a specific topic, also to raise awareness to intersectional approaches. The country missions give me the chance to have conversations in states, with governments, with civil society, and older persons themselves. So I really have a chance to look into the legal and policy structures. I have a chance to hear from older persons about their lived realities and where they see the barriers which hinder them to fully enjoy their human rights. And I registered during all these missions I had to Finland, Dominican Republic, Nigeria, Bangladesh, that ageism is not a well-known concept on the one hand, but everybody refers in one way or another to it with negative stereotypes, or that they are seen as the burden of society, that they are not valued. And on the other hand, I also realized that age discrimination is easily excused and very often not part of anti-discrimination law. So we see this, the concept is not well known and the legal framework is not in place. I started my mandate during the COVID pandemic, and I really saw what everybody just mentioned, that there were a lot of violations of older persons in care homes, but also in other settings. And from my perspective, I could only say that older persons are left behind. This is why I also focused in my first report on the COVID crisis and the impact of the COVID crisis on the lived realities and on the human rights of older persons. And we saw from my perspective, very clearly that older persons faced ageism in all the different aspects. There were no life-saving issues. They were seen as a burden of the society. And in the end, they also had to face triage decisions, which once again showed us that older life was not valued in the same way as others. So these are breaches and violations of human rights. To raise the profile of older persons as the most diverse group, I also focus on intersectional approach. One report focused on older women. I think we just heard what is all missing. And thank you also for mentioning that violations of also sexual abuse is very often seen, but there are almost no statistic on this. Older women are totally overlooked. The surveys do not include older women, especially not in care homes. And regularly there are no shelters available for older women and no good information. So I reiterate, from my perspective, this is also another evidence-based approach, that there is structural ageism, and ageism is one of the root causes while older women are not visible when it comes to data on sexual violence and domestic violence. I also did the report on ageism and age discrimination, also to the Human Rights Council, to once again show that there is a huge gap in the current human rights framework. Many of you might already have noticed that there is no dedicated article on age discrimination, which is why it's so easy to find excuses for age discrimination also on national level. Older persons deprived of liberty was another report where we saw that older prisoners are deprived of their when they are deprived of their liberty, do not get the care support which is needed, and also not the health support. And very often also the institutions are not taking into account what is really needed for aging prisoners, but the numbers are also increasing. But we also tackled the issue, or I also tackled the issue on older persons deprived of liberty in care settings, to once again raise awareness that even if it's not a prison, but there are many different issues how you can deprive an older person from him or her liberty. Then last week, I released a report on climate change-induced disaster management and its impact on the human rights of older persons in New York. And I got a lot of support from member states that older people are totally overlooked in their disaster management strategies and their evacuation programs, and also in building back. They are not the first one who get adequate housing. So I would like to share with you that we got some support in this regard, because there were more member states who were included in this discussion. But the biggest number of member states whoever showed interest in the mandate's report was the report on violence against older persons, which I launched at the Human Rights Council 2 weeks ago. 76 member states, which is really a big number to be present at the Human Rights Council, showed interest, had their own statement, supported the mandate in my recommendations, and also had some very good questions, which means they really want to engage and want to work on the issue. Just to show you that there is interest, even though we are a very small mandate and we are still trying to raise awareness that this is also a human rights issue. We are not only talking about health issues. This is a human rights issue if older people's rights are violated. So the starting point of my report, as always, is that the number of older persons is increasing. We live longer, the birth rates are decreasing. So the demographic change is globally detected, and everybody knows about this, that there are now more millions of older persons, which also have a high risk in their full diversity to experience violence. And this violence has also a wide range in all different aspects. As you can imagine, we are not only an older persons, we do have different layers of personality. So we are either a woman with a good or secure background, economic background, or we might also have a migrant background. So these are all different layers of personality, which gives also a good chance that one of our rights is violated. The World Health Organization recently estimated that 1 in 6 older persons has experienced some form of violence already. So this is why I focused in my current report on violence against, neglect and abuse of older persons, which remains totally overlooked in most of the societies. Violence against older persons is far-reaching and has far-reaching consequences on mental and physical well-being of millions of older persons around the world. Abuse of older persons has really increased tremendously during the COVID pandemic, and I think everybody already realized this. But what are the lessons learned? What kind of, preventive measures are there now taken into account by all the member states? Can we check this again? I think it would be a good tool to once again ask, what kind of lessons have we really learned? And we also see that the violations are intensified during the ongoing crisis, like the armed conflict, which was already mentioned in the chat as well, and also the impact on climate change. And combating violence is really not a priority, neither on national, nor regional, nor global level. I think one thing is the limited understanding of the phenomenon, which also leads to a huge taboo. Nobody wants to talk about this. But on the other hand, as we also heard already, is that there is no much research. There is no much data, so we are still missing the open discussion, which is evidence-based. I think this is also something we need to change, get more research done on the topic. Until today, there is not really a globally accepted definition on violence against older persons or elder abuse, however you call it. The use of the different terminology always have also different nuances, which are brought to the discussion. And while we know it does not exist a definition, we very often hear the definition of WHO, which says, I quote here, a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person, end of quote. While there are a lot of debates about the definition, I think we can agree that there are very often 5 forms of abuse recognized, which includes physical abuse, psychological, emotional abuse, sexual abuse, financial abuse or material abuse, and neglect. I would also add, because we saw this during the COVID crisis, that there is hate speech against older persons. So I would really add this as an additional element to abuse of older persons. And because we don't have a legally binding, dedicated human rights instrument, we still need to find a better definition and some agreed language what elder abuse, violation of older persons really is. It was also mentioned that the Universal Declaration of Human Rights, which would be 75 this year, we are celebrating this anniversary throughout the year, gives us also some starting point, because older people have also not been really included in the UDHR. So this might also be a good basis for our conversation to show that now is the time to change the issue and to work on it. We do have the Convention Against Torture, we do have the Convention on the Elimination of Discrimination Against Women, the Convention on the Rights of Persons with Disabilities, but no dedicated instrument which has a specific focus on the human rights of older persons. Having said that, I once again would like to introduce that there is also regional instrument. For example, we do have an Inter-American Convention on the Rights of Older Persons, which might be also a good instrument to check what can be done or how a convention could look like, what kind of guidance is there. And this convention has introduced a specific article on violence against older persons. So just for those of you who don't know how a convention could look like, please check the OAS Inter-American Convention on the Rights of Older Persons, which gives you some ideas how a convention could look like. There's always space for improvement, but it is already a good model. Let me also reiterate what I have said a couple of times. Abuse of older persons finds its root causes in the existing and prevalence of ageism in our societies. Negative stereotypes and bias underlie the concept of ageism and can lead to harmful consequences. We heard about this already. This includes violence against older persons, abuse and neglect of older persons at different forms. The absence, as I just said, of a clear comprehensive prohibition of ageism and discrimination based on age in the international law needs to be changed, because then this gives states a good guidance. Otherwise, it is on the discretion of states how they implement these different aspects on the national level. Furthermore, the intersection of age with other factors of discrimination increase the risk of older people facing abuse. Multiple and intersectional forms of discrimination indeed aggravate existing barriers in the accessing basic services, including healthcare, which was also mentioned by Kiran already, housing, employment, education, and leading to a situation of increased vulnerability that are increasing grounds for all forms of violence. However, understanding of the impact of age and intersectional identities remain very limited, and further research is also really needed. Properly addressing violence against abuse and neglect of older persons belonging to a specific group must be the next step. Abuse of older persons requires urgent action and attention from member states, together with other key stakeholders. It is a global human rights issue, and it's not a healthcare issue. According to the World Health Organization, almost 16% of older persons have experienced some form of violence in their lives. And older persons are very often older victims who face a combination of violent acts. In my view, preventive measures appear the most effective and long-term way of tackling all forms of violence. This is why a comprehensive prevention strategy is required and should address abuse of older persons. Significant change can be developed through inclusive design and implementation of national action plans, as well as the adoption of implementation of legal provisions in national law. To achieve a sustainable system, the establishment of monitoring mechanisms, prevention programs, data collection, and access to essential services is also essential. And lastly, I would also like to once again reiterate that the collaboration among various sectors, such as health, justice, and civil society, is crucial for effective prevention or protection of older persons. We need to break up those silos in which we are working and really must strengthen our cooperation to achieve a common goal. Therefore, also disaggregated data is key, as well as training for the relevant actors to know with who they need to talk to get more traction on the national level as well on the international level. To tackle abuse of older persons, it is essential for states to openly acknowledge and confront the various forms of abuse, considering intersecting forms and countering stigma and hate speech. For this, comprehensive measures are really required, including the enactment of robust legislation, the formulation of national action plans, and monitoring, as I said before. But we also need a robust civil society movement, which calls on governments to focus on older persons and their full enjoyment of human rights. We have to embrace also the additional years and showcase that there are positive developments for each of us, which need to be celebrated. To highlight the positive images of older persons, we need to encourage their full participation and support of organizations which represent older persons. To hammer down the slogan, from my perspective, that ageism will create problems for every individual if we do not manage to openly tackle the issue. And let me also say my last sentence, even though the youth of today is in the focus of every discussion, but they will be the older persons of tomorrow. I thank you all for the opportunity to speak today.
Thank you so much, Claudia. That was very insightful, and I'm just, I was taking down notes around some of the comments you made around, the lack of definition still. I mean, I've worked in the field for over 20 years, and we're still talking about the definition and that data collection that, we could have been starting years ago. And it seems to be some of these smaller, it seems on a small scale that we can move forward so much quickly if we're able to, just to come to some consensus on that to move the agenda forward. And I commend you again for all the work that you've been doing to bring a voice to this, and especially being the only person in your role at the UN. And just goes to show again that we need to advocate more to have youth, so you also have support and input to push this agenda forward too. So I know we have some questions for our speakers that may bring other issues to light. So I'm just going to ask Benedict to maybe bring those forward.
Okay, yes, there was quite a lot of activity during the presentation. I tried to keep up with everyone and answer some of them that were more technical. So before we launch into the questions, I just want to say someone flagged for us that the link, the bit.ly CCAA Ageism does not work right now, which is unfortunate. Kiran and Margaret have requested that their tech person fix that as soon as possible. If you want to have more information about the coalition until then, I recommend that you go to the link that I've shared in the chat box a few times, which is the website of ILC Canada. I will plop it in again one more time. If you are patient with me, there we go. We'll do this, everyone, and you will be able to get more information, and then we'll get that link fixed as soon as possible. So in terms of questions, we have a lot. There are quite a few hot debates about what constitutes an older person and what is the cutoff age and who is old enough or not old enough. So I'll leave that up to all of you to decide for yourselves. But there was a question actually about the convention, and would the convention recognize the vast differences that there can be between someone who is 58 or 60 and someone who is 92? Would there be provisions made for this, and how would they address the different age groups within the older population? And I don't know if this is something, Margaret or Claudia, that you want to talk about.
Till today, there is no definition who is an older person. But if we look at the range of rights we will tackle, then it is the right to work. It is also the right to social security, and there might be other rights as well. So there will be a definition which will be based on social structures, which will be applicable worldwide on a global issue. And from my perspective, we are still not there to really know how a definition could look like.
I think it's really interesting. When we had the first conversation with Ambassador Ray back a couple of years ago, Kiran and I, when he first came in as ambassador, he said to us, why doesn't someone write this up? Because make people fight to say no. And part of that would be defining some of these pieces. So that is an area, we've been pushing the government to, if you're not even going to support it, at least let's start writing it. And I think there is some movement afoot with civil society internationally to do that, possibly at the Human Rights Council.
Right. So, speaking of government, I see, Kiran, you asked, you wanted to answer a question.
Well, I just wanted to chime in here about the whole issue of old age, right? So here's the point. Most people don't do anything based on just the number, right? It's just a number. What we're trying to say is that regardless of that number, you still have the same basic human rights. That's all we're saying. We're not asking for more things for older people. We're just saying that human rights should not be ending at a certain age. We have human rights from the day we're born till the day we die, the same rights. So that's my point. The other thing I wanted to say is that, one of the biggest challenges we have in fighting ageism, there are three types of ageisms. One is interpersonal, where if I discriminate against you because you're a certain age. Second is institutional, where you go into a hospital or, in Canada, wherever, you don't get the same treatment because of your age. But the third one, which is probably the most difficult to deal with, is self-ageism, is people don't see themselves in a realistic way, congruent with their age. And, the problem is, Benedict, that you don't know that you're going to lose your rights until you lose them. That's the issue, right? It's an unconscious bias by definition most of the time. So that is the issue. And then the third thing, I'll just say this quickly. There was someone who wrote how many panelists are aware of, and there was a whole slew of, different sort of rights. None of those rights actually cover what we're talking about today. The Universal Declaration of Human Rights does not cover it. We have many, many treaties since then. The Treaty Convention on the Child, on women, on migrant workers, disabled people. Why do we need those? Because there are special needs for that particular segment of the population. We are arguing for the same thing for older persons. That's the point. So I will stop there. I hope that it touches on some of your questions.
It really does, and it was a very good reminder, actually. And actually, if you don't mind, Kiran, we're going to stay with you because there was a question in the Q&A that you indicated you wanted to answer. Marion wanted to know if the Canadian Coalition Against Ageism, had already met with the new seniors minister, who is the Minister of Labour and Seniors, which has been disappointing for quite a few of us to see that the seniors portfolio was kind of subsumed under another one. Mm-hmm. So have you had a chance to meet with the new minister, and what came out of that?
Mm-hmm. I'm going to let Margie start that one, please.
Yeah, I had a brief meeting with the minister last week because he was at the National Pensioners Federation meeting, and I kind of ran into him in the hallway and briefly mentioned the convention to him and some of the work we're doing. And Kiran and I also met with his staff. He was asked immediately at the National Pensioners Federation how he was going to handle all the work that's required for older persons, plus the work of being Minister for Labour. And there's been, the National Pensioners Federation and Costco, I think Leslie Godet's on here, they've been quite vocal about the fact that it was really insulting to move from having a single minister responsible for seniors to adding it to someone with Labour. And you'll recall when he got the job, there was like a huge labor dispute at the border in BC, and he was completely caught up in that. His answer to that, which was interesting, was, well, I've always fought for people who have been discriminated against, so why don't you watch me and see what I'll do before you judge me? So that was his response to it. We'll see. It's a big job to juggle both, and I think we just can't deny that. Nevertheless, Kiran and I did meet with his representative. He told us we will get a face-to-face with the minister as representatives of CCAA and ILC Canada. We put a number of demands on the table, including joining us on CCAA and Ageism campaign, which, Kiran, I'll let you talk about that. You led that talk, and I spoke about the convention. I asked the minister to come to New York to be at the Open-Ended Working Group. We asked that the minister, we have the same things as others, that there be another meeting with member states at an event at the UN. And we've asked the minister to speak at our side event and at the UN. So we'll see. Those requests are in. And Kiran, I'm sorry, you might want to add in a bit about CCAA in terms of.
Yeah, so Benedict, thank you for the question and whoever posted it. We are absolutely on his radar. I think that we have invited him to come and talk to the CCAA steering committee. We actually invited him on your behalf to come and speak today, but it wasn't possible at this webinar today. But we do have a commitment from him that he will deliver on the goods. So we'll hold his feet to the fire.
Good. And we have also requested a meeting. So we will continue asking over and over. I'm going to try to get through a few more questions. We have probably a couple more minutes. One of them was regarding ageism and what we know of it in terms of studies. Have there been any studies on ageism, either by culture or that measure the impact of ageism, the cost of ageism?
Yes. May I, Margie and Claudia?
Go ahead. Yeah, go ahead.
So let me start by saying thank you for the question. Whenever we talk about these things, people say we don't have enough data, or we need more studies. Well, let me tell you, and look, I'm an academic. Okay, we publish a lot of academic papers, but this is what I've been telling all my colleagues for the past 12 months. Stop publishing and start doing something about it. That's what I want people on the call to do, is do something about it. We have mountains of data. There are now huge gaps in human rights violation. The amount of data we have. Look, Claudia's paper, we have a full gaps paper that was published, through Andrew Burns. So that the current human rights system does not meet the needs of older people. Therefore, I urge you to strongly invest in your own future. The only remedy that is urgently needed during this pandemic, the one thing this pandemic has taught us is that ageism is alive and well, and it will eat you up alive if you let it. So please advocate, talk to your politicians, call ageism out, and there's lots of tools and products and services to help you. So you too can age with rights. It's not just about older people, it's about the future older people as well. Thank you.
Thank you very much for this. Rayanne, I'm aware we've got like 3 minutes left, so maybe I'll let you kind of close it up. I know you had a few more things to say.
Yeah, no, I just wanted to say, yeah, I think the calls to action that everyone has just spoken on, I think it's really important that, as Kiran indicated, we can all take some sort of action. And I think, just building also on the work that the Canadian Network for the Prevention of has done on the Future Us document around looking at people's engagement, addressing elder abuse, ageism, the human rights of individuals that all intersects is, look at where you fit in the picture. Are you as an individual, or in the community, where you are in your workplace or government? We can all take, and sometimes that's 2 or 3 different roles, right? Depending on where you are. And, looking at even around your family table, having conversations. This is, in Canada, we have our Thanksgiving weekend. Are we connecting with our elders and older adult family members, checking in on neighbors, inviting them, doing that social connection that we can all, play a role? It can be those small little actions, but they all kind of build up to creating a better, safer, supportive community for older adults, and building those connections with the younger individuals. And as Claudia mentioned, that intergenerational work, or intergenerational, that connections that we need as well. And in that, working across sectors, I think, is so important, as Claudia mentioned too. We can't work in silos anymore. I think we're getting much better at that. And sharing amongst each other, and everyone taking on a different piece of what needs to be done, and coming and having sessions like this where we can bring different voices and different at the table to start strategizing and moving that agenda forward and move the needle. The social movement, let's make this global movement an actual huge movement forward, so we can get those leaders and governments to not only work towards the prevention of abuse, put the funding towards it, because that's where we know that if we can stop it from happening, then we don't have to address the crisis in the long run. So I want to thank my colleagues. I want to thank all the speakers for taking their time, each and every one of you, and my colleague Benedict for helping collaborate and host this session. Again, always enjoy these opportunities to bring these important issues at a national level, so we can be in every province and territory across Canada. So we will be posting, as a reminder, just give us a couple days as we join into a long weekend to get all this information. Any of the posts or links that Benedict was posting, we'll try to put those on our website and fix the link so you can join and get the information, as Kiran had indicated, for the Canadian Coalition on Ageism to join, and the reports that Dr. Mahler has written. Those links will be there available for people to read. It's an excellent report that she has done, and other links that she had mentioned today, other reports that sort of align with the work that she's doing today. So thank you, everyone. Enjoy your weekend. And Benedict has one last comment.
One last thing, a reminder that today was the webinar, but Ageism Awareness Day is on October 7th. It falls on the Saturday. It falls on the Thanksgiving weekend, but it doesn't mean that you can't participate. So we will be sharing a lot on social media in the days before, during, and after as well. If you are on social media, please do support it, share the materials, or it can just be the day you take the first step and start speaking up. I see a lot of comments about hesitating and being afraid. So maybe that's your exercise for the weekend. Take in Ageism Awareness Day and say something.
And we, both of our organizations and ILC, we're on social media, Facebook, X, Twitter, and LinkedIn and whatever. So, look our names up, our organizations, and, follow and retweet or whatever you can do to get that word out. And we really appreciate your involvement today and participation to the end of our discussion today. So thank you.
Thank you, everyone.
Bye,
This is
everyone.
Great. Really
Lovely.
appreciate it.
Bye
Bye,
bye.
Claudia.
Thank
Bye,
you for
Margie.
joining us.
Bye, Benedict. Thank you. Rianne,
Thanks.
thanks. Bye, Rosa.
Bye.